Welcome to your channel Possible Medico Wallah. We are going to discuss about nature and sources of drugs. What is drugs? The drugs are the chemical compounds that affect our immune systems and rectify our disease systems. And also we have classified drugs. Okay, drugs in two types, that is physical and chemical. Okay, first come to physical. In physical, that is in solid, means you know the tablet, capsule, lozenges, and there are too many forms. Okay, then comes liquid. Okay, in liquid you know suspension. Okay, and you know emulsions. These are very famous in liquid. And you know the semi solid, like very popular is lotion. Okay, in chemical we have divided it in organic and inorganic. Okay, in inorganic we use metals like you know lithium carbonate, that is used for maniac, and also you know that magnesium salt. These are also used in our constipation and laxative cases. In case of organic, it is you know acidic and basic. Okay, in acidic and basic, remember acidic is aspirin and basic is morphine. These are two important drugs. Okay, then we talk about the sources. Okay, so based on the sources, drug sources are of three types. Okay, that is, one is natural and another is semi-synthetic and another is synthetic. Okay, in natural we can collect natural drugs from everywhere. Okay, just like first case comes to plant have rich chemical sources. Okay, just like you know glycoside consists of glycon and aglycon part. Okay, and this is the main part. Okay, and these play a role in main mechanism of action. Okay, you know the example of cardiac glycoside, that is digoxin, that plays important role in cardiac heart failure. Okay, then comes alkaloids. Alkaloids are you know nitrogen containing compounds. Okay, these are most important compound because this includes ephedra like compounds, means these are adrenergic drugs. Okay, then comes oils. Oils plays an important role, just like you know there are two types of oils, like fix oil, or that is also known as non-volatile. Another type is volatile. Okay, In case of volatile, these are temperature successible, means they can evaporate in normal room temperature. That's why they are always kept in closed container. Example is clove oil. You know clove oil. Clove oil is also used as pain relief. Okay, and also eucalyptus oil, also used as carminative. Okay, and when you come to non-volatile, these are fixed. They don't evaporate in normal room temperature. That's why you can keep it few time open. Okay, examples like castor oil. You know castor oil and coconut oil. They can give relief, pain. Okay, relief pain, and also another function is purgative action. Okay, means they will loosen the stool. Okay, and then comes animal sources. Animals like pigs, cows, horses. Cows and horses are generally used for vaccine development. Antivenom that is prepared from horses. Okay, then from pigs we used to extract insulin. But nowadays we use biotechnological derived insulin, that is humulin, that is extracted from E. coli. Okay, then comes microbiology, means microbiological sources. Okay, means I have already told you E. coli. E. coli is already used for humulin. This is the most used microorganisms. Other sources are there, but they're not that much useful. This is very useful. And then comes another classification, semi-synthetic. In semi-synthetic, these are natural. Okay, but they are modified, slightly modified. Okay, then they becomes semi-synthetic. Okay, like morphine. Morphine is extracted from coca plant. Okay, but slightly change it, then it can be converted to many drugs. Okay, and also another drugs like you know hydromorphine, and also another product is acetylated morphine. Okay, then comes synthetic. Synthetic means they are purely made in laboratory. Okay, in laboratory means by using some chemical reactions. Okay, just like aspirin. Aspirin, that is the acetyl salicylic acid, that is purely made in lab. Okay, I have told you about biotechnology product, na? That is rDNA product, recombinant DNA product. Means by using vector we cause DNA alteration, and after that we extract product. And humulin Humulin is the best example and with very less side effect. And also there is another example is alteplase. Okay, but in this we use human kidney cells. Okay, till now our sources finished. Okay, now we will study nomenclature. Okay, drug nomenclature is broadly classified into three, that is chemical means IPAC, okay, non-proprietary, and another is proprietary. Okay, these three. First, you know acetyl salicylic acid. Okay, this is the IPAC name. But when it comes to non-proprietary, it is known as aspirin, and this name is given by USAN, BAN. There are several authority, they give nomenclature, like this the British authority, this is the US authority. Okay, when it comes to proprietary, it is the brand name, means aspirin comes in Calpol, sometimes it comes in Disprin. Okay, like this. Okay, then our nomenclature part is finished. Okay, then we will talk about the drug source, means information. You can name it as Compendia also, means which contain all information about drugs, like assay methods, solubility profile there, physical chemical properties are there. Okay, so it is of two types. Okay, that is official means it is published by using official gazettes, means use our Indian government publish some official gazette every year to renew our drug database like pharmacopoeia, formularies. Okay, just like this every country publish. And also non-official means it is published by certain society, they can use their knowledge to help everyone. Okay, just like in official case means two books, pharmacopoeia and formulary. Okay, in this there is extra pharmacopoeia that is developed by Royal Society. Okay, this is developed by Royal Society, and non-official are followed in countries where pharmacopoeia is not there. Okay, but in India our pharmacopoeia is there. Okay, then I will tell you the pharmacopoeia. What is pharmacopoeia? In pharmacopoeia, we used to search drugs in the form of monographs. Okay, remember, in form of monographs, not on the basis of mechanism action, not on the basis of any code or anything. Okay, just like in monographs only. Okay, in this assay methods, if any FDC there, FDC means if any fixed composition is there, then how much composition should be there, that is also present. And also physical and chemical properties are there. Okay. And also most important thing is in pharmacopoeia is the important document. Okay, important document in which every nation has to follow these guidelines. Okay, then comes formularies. Formularies are just the summary form of this, means they don't contain any assay methods or any physical properties. Okay, they just contain normal drug data, like contraindications. Contraindications means when to stop and when to continue. Okay, just like that. And also it contains probability adverse effects. What adverse effect can happen, and also it contains FDC, just like pharmacopoeia. Okay, FDC means fixed dose compound, means if contain two or more drugs should be there, then in which composition should be there and in which case it should be used. Okay, just like that, means it is generally used by prescribers, means doctors, for easy understanding. Okay, then I will tell you few differences. Okay, like essential versus orphan drugs. Okay, essential means these drugs are essential for public health maintenance and they are available at low cost. Generally, they can be of OTC drugs and precision drugs, but majority are available in OTC. Okay, means you can tell that low cost. But orphan drugs are only used when some endemic condition is there. Means before few days COVID-19 is there. In that condition, orphan drugs are used. And also very few years ago, Ebola. Okay, Ebola there. In Africa, HIV is furious, means their transmission is very high. That they have developed very few drugs for to control this HIV. You can call that orphan drug. They don't generally produce it because of economical barrier, but when necessary it can be produced. That's why it is known as life-saving drugs. Okay. Essential drugs is of, essential drug is of two types. Okay, like prescription and non-prescription. Okay, prescription and non-prescription. Prescription means generally these include schedule H and G. Okay, two category generally they include. H means prescription drug. G means on the supervision of any doctor or any physician. Okay, but these drugs includes severe antibiotics. Okay, and also morphine, codeine, and also steroids. But non-prescription drugs are generally OTC drugs. Okay, and OTC drugs includes paracetamol, aspirin, and there are many low dose antibiotics. Okay, these things. Okay, the main point is they contain less adverse effect, but if you abuse it, then it will produce harmful effect. Sometimes it will produce resistance, that is dangerous. Okay, nowadays what is happening, they are giving one drug, but it contains impurities and other compound. Means they want to increase or decrease the effect by mixing any substituents. Okay, like that. Okay, see, these are the notes we have prepared for your easy understanding. Okay, I have given a reference in our video sections for your more study, and also I have told you only basic concept so that you can understand. If you want to learn more, then comment. Thank you.